Good morning. Uh, Another case, I talk about digital dentistry and digital involvement into the dentistry, which has made our life very easy and surgical planning and surgery very predictable. Today's case is 6 implants which I'm putting today with some of the extractions and most of the extractions and immediate placements like I always do. This is the same case which I showed some days before, where we have extracted the tooth and placed the implant and immediate temporization has done. This patient was planning to go abroad, but because of the visa problem, the planning is being delayed. So as I have already discussed that this case was planned for full mouth rehabilitation, and patient doesn't want to extract everything and place all the implant together. So we are doing this stage wise placement of implant, where the strategic implants are placed, and in future if required, all this implant can be fused into a single processes and a full mouth rehabilitation can be done. So today's case is already been planned. So this is what a digital planning looks like. This is a software where a CVCT raw images called DICOM images is been fed, and this gives me all the information in panoramic view, in 3D view, in cross sections. So whenever I want to place the implant, what I do is I go here and place a virtual implants. So this is the same size and same width of the implant by the same company which I am using today. So the width and length of the implant which I am using can be placed virtually here, and in cross sections I can check the length and width here if it is proper or not. Same thing can be checked here into 3D images, where the alignment, the level of the implant, look at the level of all 4 implants which is planned are in the same level, and now I know how much bone reduction and how much depth I should be placing the implant in, and what is the length and width of the implant is available. This is very critical here in this area, where there is a nerve which is going through the bone. So I'll just show you. This is this black round empty cavity into the bone is a nerve. This is called inferior villal nerve. Can you see this 2 white lines and the black pipe-like structure which is going through the bone? So this is the nerve which we have to avoid, and by avoiding, what is the optimum level of length and width I can get. Another information is this sudden dip into the bone here onto the tongue side, the lingual side. This may not be visible here into 2-dimensional X-ray. Here I cannot get that information, so I cannot decide the angulation of my implant depending upon that 2-dimension X-ray, and there can be accidents where the novice dentists or younger students do is they place their implant and the implant gets sunk into this cavity. They think that there is a lot of bone available, so I have a bone which I can place the implant in straight direction, but I can't tilt my implant like this if the cavity is too superficial and I want to place a longer implant. Wherever possible, we place a straight implant, but if that cavity is or the implant placement is it poses a risk of my implant getting sunk into this space, we don't put that implant. So today's case is the plan is placing this 3 implants after extraction of root pieces. This 2 implants in one in canine and one in premolar region, and one more implant into the upper first molar region. So this upper first molar region is little critical here. I do have a very less bone even after extraction. So after extraction, I am going to place my implant between the bone between the roots of this teeth, and maybe I'll be pushing the floor of the sinus. So this black empty cavity is the sinus, where I'll be pushing my implant into the sinus, and I'll be able to engage 8 mm into 5 mm into 8 mm of active implants. So now, because I've done this virtual surgery, my guesswork, my accidents and surprises during surgery has completely eliminated. I am 100% sure where I'm going to place my implants, and I'm 100% sure about the bone quantity, angulation and the sizes of the implant. Though we do have sizes fixed, sometimes there are chances that we get a bone fractures, or we may have to place a larger or different size of implants. So all the sizes of implants are available here. We're gonna use 6 implants. Some of the implants are for one more surgery which I'm planning on Monday, but we do have spare sizes also available, and most of the implants which I'm gonna place as the digital planning has been done. This has eliminated all my guessworks, and now the surgery has become predictable. So this is the first step of digital implant surgeries or digital implant workflow, which I talk about a lot, where my digital data helped me do a virtual surgery before actually doing a surgery in a patient. We'll be operating in another 15 minutes. This planning has been done already yesterday. This is for just explanation and a video purposes that I'm showing this planning. This planning has been done yesterday, and the implants are ordered accordingly. Thank you very much.